Hello, buenas tardes.
Julia Fernandez used to be a stay-home mom, and her children qualify for Medicaid. But she recently began to work, and although two of her children are covered under the S-chip, one was left out of the program.
Because of my salary, they say I no longer qualify for the insurance and close the case for my youngest child. And let me tell you that even though it is an insurance from the city, I pay $18 a month for both children. Well, they closed the case for my youngest child because I supposedly make too much money.
Julia is now worried for her youngest child. She is afraid something would happen and she won't be able to cover it.
If I have to go to an emergency room, the first thing they ask you is not about the situation you may have at the moment or how sick the patient is. It's whether or not you have health insurance, which means who's going to cover the expenses.
But now, with the extension of the program, Julia's youngest child may be one of the additional 4 million children that will be covered within the next 4 years.
Well, Michael Cannon, this was a problem that you had suggested earlier in the program, but S-chip seems to have fixed it rather than made it worse.
Actually, it hasn't really fixed it. That problem still exists. It just exists for Julia when she takes that next step. When she gets that next raise, it's going to make her ineligible. And so instead of eliminating what we call a low-wage trap, we're just expanding the number of people who fall into that low-wage trap, who face those disincentives to keep climbing the economic ladder.
When you write legislation, how do you fix that kind of thing? When problems are pointed out in the mechanics of the way a program's working, how do you fix it?
Yeah. Well, you know, certainly, I mean, the issue has been brought up. You know, we always have to be careful that it doesn't bring in the folks that have insurance and bring it in. We're trying to fix an issue and trying to draft legislation. I used to be at the state, and also I understand about states' right, and now I'm at the federal level. What role does the federal government come in? But it's difficult to draft that legislation because you can't draft it or cover every single piece of or every single scenario that we have, but you still try to cover the overall good. And here we're trying our best to cover what I call the working middle class that just cannot, or making enough money to live along, but just cannot afford that insurance, which is you know a month, $1,000, whatever. That $1,000 will be for a house payment or for rent or whatever it might be, or prescription drugs. But we're trying to do our best. You know, we want to get a system that's efficient, that's effective, and accountable to the taxpayer. And we also expect the private sector gets involved, the doctors, the hospitals, and the other health providers, to be efficient, effective, and accountable also.
But when something passes after a big political tug of war and a lot of argument and a lot of debate, and you finally slide something in and it's got adjustments to bring in votes that you need to get it passed, is it hard to go back a year later, 2 years later, when you see that aspects aren't really working the way you thought they were going to, or things are happening to people that you didn't understand were going to happen as a result? Is it hard to go in and fix it, or does everybody understand it needs to be done?
Yeah, well, I mean, it just depends what the fixing is. You know, sometimes it's you can come back, what I call, and do some fine-tuning on a piece of legislation. There's always some fine-tuning. Or sometimes people say, well, let's give it a little bit of time and let's see how it works before we make any changes. For example, the Leave No Child Behind with our former governor from Texas, Bush, we wanted to make some changes, but he took a position, we're going to evaluate this for 5 years and then we'll come back and make changes. Same thing with CHIP, it just depends what it is and if people are willing to make that change.